Hi, I'm Dr. Michael Carr-Gregg. I've been asked by Queensland Education to help parents and teachers work together to boost the well-being and learning of young people. One of the most important topics we're going to be talking about in this series is the idea of resilience. That's the capacity of young people to face, overcome, and be transformed by adversity. While we all want to ensure that our children lead engaged, meaningful and pleasurable lives, the reality is that random and chaos happens in the universe, and that almost all children will face some degree of adversity as they grow up. The truth is that all of life's important lessons are usually accompanied by a degree of grief, pain and suffering. Children learn through good and bad experiences, and it's often through our mistakes and challenges that we learn how to cope. Another important component of this series will be a discussion of the idea of resilience. Now, in every young person, there are a balance of risk and protective factors that determine how they'll cope when faced with adversity.
These processes can be individual coping strategies, or may be helped along by good families, schools, communities, and social policies that make resilience more likely to occur. In this sense, resilience occurs when there are cumulative protective factors.
These factors are likely to play a more and more important role the greater the individual's exposure to cumulative risk factors. The phrase risk and resilience in this area of study is quite common. Of all the gifts we can give children, it would have to be one of the most important.
Now, research tells us that there are 5 key components to resilience.
Social and emotional competencies. These refer to one's ability to express or release one's inner feelings. It implies an ease around others and determines one's ability to effectively and successfully lead and express. It is described as the essential social skills to recognise, interpret and respond constructively to emotions in yourself and others. Islands of competence. This is the extent to which young people are actively engaged in art, music, dance, sport and drama. The presence of a charismatic adult in their lives. Do they have someone who makes them feel safe, valued and listened to? Positive self-talk. Positive self-talk is any thought you think or any speech you say to yourself that uplifts your social, moral, spiritual well-being and results in improvement. Positive self-talk can be used for greater confidence, adopting a healthier lifestyle and reducing stress. Connectedness. It is a sense of being a part of something larger than oneself. It is a sense of belonging or a sense of accompaniment. The American Psychological Association suggests 10 ways to build resilience, which are 1. Maintaining good relationships with close family members, friends and others. 2. To avoid seeing crises or stressful events as unbearable problems. 3. To accept circumstances that cannot be changed. 4. To develop realistic goals and move towards them. 5. To take decisive actions in adverse situations. 6. To look for opportunities of self-discovery after a struggle with loss. 7. Developing self-confidence. 8. To keep a long-term perspective and consider the stressful event in a broader context. 9. To maintain a hopeful outlook, expecting good things and visualising what is wished. And 10. To take care of one's mind and body, exercising regularly, paying attention to one's own needs and feelings, and engaging in relaxing activities that one enjoys. Learning from the past and maintaining flexibility and balance in life are also cited. Remember, Voltaire said, "No snowflake in an avalanche ever feels responsible." Teaching these skills is a parental responsibility that cannot be outsourced to anyone else.